Hi, thank you all for joining us today. We'll go ahead and get started. My name is Ashley Mateka. I am the Director of Creative Healing for Youth in Pain, also known as CHIP. Today we have our September webinar, Adolescent Depression, Recognizing Signs, Parenting Tips, and Navigating Through Hard Times. Before I introduce our guest speaker and moderator, I just wanted to share a bit about all of the exciting events and programs we have going on at CHIP this month. Our Creating Bonds for Youth and for Parents start in September. We're very excited about that. We also have a creative healing workshop for youth next week about comics. And what I'm most excited about is next week we actually have our fall fundraising event, which will be in Beverly Hills. We have our auction that is starting tomorrow. So even if you're not able to attend the in-person event next week, we'd love for you to check out our auction. Information about the event and the auction can be found at mychip.org/fall-fundraiser. And we'll go ahead and put that link in the chat for you as well. All right, back to our webinar. So today we have Dr. Sylvanna Vargas joining us. She is a licensed clinical psychologist specializing in the prevention of adolescent depression and suicide. She's a postdoctoral fellow in the departments of psychology and psychiatry at UCLA. In addition, we have our moderator, Dana Pachulski. Dana is a member of the CHIP Executive Board, as well as the board of the UCLA Resnick Neuropsychiatric Hospital, and is vice chair of Cedars-Sinai Board of Governors. She's also the vice chair of the USC Parent Leadership Circle. Thank you, Dr. Vargas and Dana, for joining us today.
Thank you, Ashley. Thank you, Dr. Vargas, and thank you, everybody, for taking time to join us today and possibly later on YouTube channel. We're so grateful for Dr. Vargas to join us today and allow us to video this discussion on depression and different signs and things that we can do to help people regarding the emotional side of depression, the physiological responses that our body presents with. How do we navigate those two things, right? It's the chicken and the egg. Is it the stomach ache that gives us the first sign that we should be paying attention that there's something bothering really us emotionally? Or is it the fact that they're, our children not leaving their room or not eating or all the different signs? So Dr. Vargas, thank you for helping to elaborate on all the warning signs, and let us just start our discussion on, what do you see? What are the things for us to look out for? And we'll flow from there.
Sure. Yeah. So happy to be here. Thanks so much again for having me. So when I think about adolescent depression, I think about a bunch of different symptoms that can come up. And some of those, like you're getting at, some of those are like what we would traditionally think of as like feeling symptoms, and some of them are more physical. So some of the hallmarks of depression are feeling pretty persistently sad, or like what we would call like depressed or blue. But for teenagers, sometimes that sadness will actually show up as irritability. So more than what's normal, right? So sort of thinking about like your baseline, this is a change from what is like your normal. And so thinking about, depressed mood, we see a lot of loss of interest. So, not being interested in things that you used to be interested in, not feeling like fulfilled by the things that used to fulfill you. And then there are all these cluster of more physical symptoms, like changes in your eating, changes in your sleep. So this could be eating more than usual or eating less, having changes in your appetite or weight, not being able to sleep or sleeping more than usual. What we call psychomotor symptoms. So feeling like you're moving very slowly, almost like your body is like made out of lead, or the opposite, like having a really hard time sitting still and feeling really restless, feeling tired all the time. So, that chronic fatigue, difficulty with concentration. And then things that I think we are probably as a mainstream culture more used to hearing about are changes in self-esteem. So feeling really bad about yourself, feeling guilty over things that you are not really at fault for, having a hard time making decisions. And then, something that I specialize in is also that part, a symptom of depression is thinking a lot about death or having suicidal thoughts.
And that's really the trickiest part, right? Because how do we know that they're having those thoughts? So really looking at these warning signs and being well-versed in, my child usually is like this, and I'm noticing these changes, and they might be subtle, or they were subtle and we didn't see them, and suddenly it's very apparent.
Yeah. One of the things that I hear pretty often from parents of teenagers is how difficult it can be to notice these changes because your teen is constantly changing, just like developmentally, and that a lot of times teens like naturally tend to be a little more reserved. They're kind of building that developmentally appropriate autonomy, like wanting to do stuff on their own, wanting to be more independent, maybe not wanting to share everything. So it can definitely be really challenging to know that these things are happening. And I've for sure met a lot of parents who are surprised that like by the time they realize their kid was depressed, it's actually been a while and it's progressed a lot. And I think that's part of the normal and really kind of challenging part of having a teenager who's struggling with mood symptoms.
And for parents, right? Do we pay too much attention? Do we pay too little attention? That's the guilt that a lot of parents present with because we sit back. And so that's why these webinars are so important to help parents guide through and say, we're seeing these subtle changes or what to look for, but then what do we do when we see those changes? Because a lot of times it's not easy to find the right provider to then engage for our children.
Yep. That we're for sure, I think, as a country in the US, struggling with that right now. People having a really hard time getting connected with services for sure. One of the first things that you can do as a parent, this is always really tricky to talk about with parents of teenagers, but to try as much as possible to put it out there that you are available and willing to listen. The best kind of defense that you have, I say this to parents all the time when your teenager is depressed, is for them to create a way for them to come to you, whether it be for them to tell you what's going on with them or them just come to you because they're having a hard time and they want some kind of distraction. And what I hear over and over again from parents is what a challenge that will be, because teens naturally, like what their job is as a teenager is to individuate and to kind of become a little bit more independent. But there are things that you can do as a parent to try to at least signal that you are available to listen and to be there.
A lot of us parents, we are joking that when we have a really large car, kids forget that we're in it. Right. They're in the back seat. And so there's a lot of conversation that can occur in those times. And I remember, and please help me guide parents right now, but is it easier to talk to your kids when the lights are out? In a dark room, right? When you're saying good night, but then that's always tricky. Do you do it right before bed? But I remember for some people, they would say that was the best time because they weren't looking at you. They couldn't see you looking at them.
Wow, that's such a wise, I'd never heard that, but that actually is such a wise and like real life example of what we usually tell parents, which is hearing that your teenager is depressed or even having suicidal thoughts is really scary. And, because you're a parent who cares about your kids, like, of course, it can feel very alarming. And one of the best things you can do is to really not show alarm, but to really signal to your teenager that you can handle what they're telling you and that you're going to stay calm and you can be trusted with this information. Basically, like you're not going to overreact. You're not going to ask them a million questions. You're really just going to try and listen and show them that you're listening.
And then how do we engage but not over engage? Right. There's this really subtle dance that we need to do. Right. I mean, that leads me to the next thought, which is when our kids are saying something very dramatic. Right. So there's the two sides of the depressed equation. Right. There's the kids that are throwing out there because they don't have a coping skill. And so it's just like, I'm anxious and I'm depressed and I don't want to live anymore. Right. So I'd love to talk about that as an approach from a parenting standpoint. And then I'd love to flip it and say, what do we do when we're starting to see this and they're saying, I'm really anxious and I'm depressed, and we're really seeing them from that bottom of the barrel, last straw, I can't go on place. If you could spend a few minutes on both sides of that, because I think those are very common things, sometimes with the same child, but sometimes with different approaches.
Yeah, that's really tricky. So if what you have is, a teen who you feel is like overusing some of these terms, my general approach is usually when I hear a teen say, I'm depressed, or especially, I'm suicidal, or, I don't want to live. Sometimes I will hear this comment about, I don't really know that they mean it, or I'm not really sure. They're using it as a way to express that they're really in distress. And I will share, like my general approach to anyone who's having a suicidal thought is that is a really important symptom that something is really not right in their life and that they're experiencing a lot of distress. And that distress is super valid, right? And so first, I want to kind of be able to access what that distress is, like what's going on that's getting you to feel that way. And I think that's where that listening that I was talking about and validation comes in a lot. So validation, just like as a little kind of side comment. So validation is finding a way to convey to someone that what they say makes sense and that you get it. But validation doesn't have to mean that you agree. So I can validate how you're feeling without agreeing with your interpretation of a situation. Or I can validate how you're feeling without agreeing with the way that you're handling the situation. And that dance can be a real challenge, but validation, I find like the more I work with teens and parents, the more I realize like validation is like your number one thing to get down, because that can really change a dynamic. But to come back to that question of what do you do if your teenager says something like, I don't want to live? My general advice is to take that seriously, because you'd rather be safe than sorry. So even if you think it's kind of an off the cuff remark, it doesn't mean, when I say take it seriously, that doesn't mean like take your kid to the ER, right? What I mean is just like, listen to what they're saying and maybe ask some follow-up questions about what they're really trying to get at. Because it could be that your teen doesn't have the vocabulary to express that they're feeling overwhelmed, or it could actually be that they're feeling so overwhelmed that they're really reaching their limit and they're trying to let you know in the best way that they can. And so my advice to parents there always is ask some follow-up questions. You can validate, say like, wow, it seems like things are like really tough. Like what's going on, right? Like what's been going on for you that you're at this place? Shoot, I'm like, that really sucks that things are really hard in your life. And what you said kind of worried me a little bit. So I just want to check it out. Like when you say you don't want to live, like what exactly do you mean? Are you, and I actually wouldn't really shy away too much from this question of asking, are you having thoughts of hurting yourself? Because you want to know what you're dealing with in that moment, so you know how to best intervene.
So it's really important for us to ask our kids in response to that big emotion, right? Whether or not we're thinking it's an avoidance because they're lacking the skills in something, or because they really have hit their wall. The bottom line is to really, as a parent, say, I see you and I hear you, right? By saying a validating question or statement that says, wow, it's a really big emotion, and maybe take a pause and give them a chance to come back. And then the hardest part as a parent is not to try to fix it right out of the gate.
Yep. That's exactly right. Is taking a pause and really taking a moment to give space and make space for that emotion. And, I see this a lot, and I think it's totally valid that a lot of times parents will sort of say like, I can see that the issue is that my kid's not using a coping skill that they have. And that may be completely right. And I will say, I have never met a teen who tells their parent, like, I'm pissed off about something. And then the parent comes in and is like, well, what you really need is a coping skill. And then the teen goes and takes it and uses that. Usually there is this sort of like massaging. And I will say, I actually am not even sure that that's a teen thing. Like most of us in general, when we're feeling really flustered and overwhelmed, if someone comes at us and says, well, you're really just like not solving this issue correctly, that can feel really invalidating. And so it's actually, it might be harder for us to try and solve the issue if we don't find a way to bring down our emotional temperature. And that's the function of validation. They've done like brain studies and these like physio studies to look at how your emotions, when they're really high, things like validation will actually help you regulate your emotions so that you can start accessing that part of your brain that helps you problem solve.
I'd like to spend a few more minutes really going into that. We just kind of feel into our child that presents and just has an explosive moment, right? And whether it's an explosive moment that leads to a statement of self-harm, potential self-harm, or whether it's an explosion and the statement that leads to us being concerned for their well-being. I really feel like regardless of what it is, an explosive moment by our children, verbally, physically, leads us as parents to just take that pause and say, what, that's something's really hurting. I see you hurting. Taking that pause. And then if you could give us a couple more statements that we could feel into at this point, because I think for parents, right, our first fight or flight response is, oh my God, my child's hurting. What do I do? So how do we help parents and friends take that step back, take their own personal response to it, right? Because that might be triggering to the person that's sitting across from this experience.
Right.
Their personal experience out, separate, and then if you could kind of walk us through maybe some different scenarios, different first couple statements.
Yeah.
Right? We've already established, I see something's really bothering you. What would be the next few statements you'd help us come up with?
Yeah. I just want to underscore though something you said, because I think it's so important and something that often gets overlooked, which is that personal component. When someone, I say this as a therapist who often has dysregulated teens in my room, when someone is really very dysregulated in front of you, especially if they're yelling at you, if they're cursing at you, naturally our body has it's called like a physiological arousal response. Our emotions get heightened, right? And so it's really important that we figure out a way to manage our own response, to regulate our own emotions, because if we're not able to do that, it's going to be really hard to come in and try to help your teen. So taking a moment to breathe, taking a break if you need to, if you have like an affirmation that you tell yourself, or reminding yourself that you're safe, whatever it takes to be able to bring down your emotional temperature so you can be there for your teen. And then kind of coming in, and I think the strategy probably depends on what's happening in the room. So, if you're, and I think it really kind of varies case by case, but you mentioned, if your teen is being physically dysregulated. So, if your teen is throwing things or, threatening you or something like that, generally my advice actually is to leave the situation, because you also don't want to reinforce that kind of behavior. So by leaving the situation, essentially, and you can make a statement about it and sort of say like, look, I can see that you're really upset. I want to be able to talk about it, but it's really hard for me to do that when you're throwing things or when you're doing this, because this is distressing me. So I'm going to go take a beat. I'll come back in 10 minutes and see if you're ready to talk about it. So in that situation, I think the approach is a little bit different, because you don't want to keep reinforcing that behavior of, anything like physical throwing stuff or breaking stuff. If what we're talking about is, your teen is, crying, kind of having a sort of a really strong emotional reaction, I think part of the challenge here in teaching validation is that you have to find your own style, and you have to find the style that works for your teen. Some teens are really receptive to you saying like, wow, kind of like what you were saying, Dana, about like, okay, so wow, it seems like you're really hurting right now. What can I do for you? Or I'd really like to help. Do you want to talk about it? So usually I'll ask for permission. Like, do you want to talk about this? Because sometimes teens don't, like any of us, right? Sometimes we don't want to talk about things. We just want to get away from the situation, because talking about it is just going to make us feel worse. And so we actually need to take a break. And so as a parent, you can definitely do that. You can say, okay, if you need a break, let's go do something fun. Let's like, I don't know, if you got a pet dog, I feel like pet dogs are like my number one strategy in therapy. Bring in your pet dog, right? Let's cuddle your dog. Let's like talk about a new haircut. If they have outfits, in LA, I feel like everyone has dog outfits, like bring out the outfits, whatever it takes to kind of distract and give you a break from it. And our goal is to eventually come back and try to understand what was going on, but really to kind of get your teen through that moment. If your teen says, yeah, I do want to talk about it, then I mean, you've got the green light to be able to talk to your teen. So I would really try and see how much you can listen and try and see if you can get them to do a lot of talking. I would ask follow-up questions just to understand, but maybe avoid the temptation to try to like ask a lot of interrogating questions to understand the situation. I think a lot of times parents go into this like protective parent mode where they want to know, well, like who said this to you? And like, does someone at school know about this? And like, how can I intervene? And did you talk to your principal about this? Or did you tell your teacher? And like, that's probably not the moment to ask that line of questioning. You want to kind of focus on the impact that it has on your teen so that you can show them that you hear them and that you hear how they're feeling.
What you just said is so important. And I think for parents, like we have to take a pause. I don't know if you have to put your nail in your finger, you have to do something, whatever you do, to not want to ask the follow-up questions of who hurt you. How did you get in this place? Because then it takes the information and the focus off of the child that's hurting. And they don't want to fix the other situation yet. They do want to get there, but I really feel that they don't want to get there at that moment that they're having this complete, either they're allowing you in and saying, I'm hurting, and whatever that looks like, right? Again, that's throwing things, it's crying, it can be anything. It doesn't really matter, whatever they came to us and finally showed us that something's hurting. And it also, you know, we need to talk about whether that's the stomach ache or the headache. It's the physiological response to really the emotional root cause. And, you know, how do we get there? But we can only get there if we give them that minute to cry and feel seen and heard. And now I will say on the other side, right, there's the child that screams and wants to be seen and heard, but will tell you they don't, and they want you to leave immediately.
Yep.
You know?
Yeah. And that, I think, is also kind of related to that wanting to jump in and problem solve, is that parent instinct again, to want to be like, wait, but I don't want to leave. Like, clearly you're going through a hard time. I want to be here for you. And, you know, I think for me, it kind of comes back to this like idea of, okay, the primary goal when your teen is going through a hard time, especially if you're suspecting that they might be depressed, especially if you've heard or are suspecting that they might have suicidal thoughts, is you do want to kind of ask just clarifying questions. If you're thinking about the, you know, oh, they're having suicidal thoughts, you do want to ask about that. And I think in general, you know, it's sort of shifting from let me solve the problem to I really want to signal to my teen that I'm open to talking about this and that I'm someone that they can trust with this information. Because, you know, number one thing I hear from teens is I can't tell my parents this because then they're going to ask me a million questions. And I don't want to be
go outside of this. They're going to go to the school. They're going to go to the parents of the friend or something. Right. And that's one of their biggest fears.
Right. They're going to go, right. They're going to intervene on my behalf. They're not going to listen to what I want, or they're going to sometimes actually asking a million questions can feel pretty invalidating because it's like you're missing the point, right? Like it's like you have your own agenda and you're not actually listening to your teen's agenda, which is to try and talk through how they're feeling. And in fact, I'm thinking as a parent, mostly parents do want to know how their teen is feeling because they want to help them get through that. And they want to help, you know, we were talking about coping skills at the beginning. And the only way that we can help anyone learn how to use a coping skill is to first understand how they're feeling from their perspective, not from our perspective of how they're feeling. And that can be kind of challenging when you're talking about, like we were kind of getting at this earlier, when you're talking about someone who's just learning how to identify what they're feeling. Right. So your teen might not have the vocabulary to be able to really like label what it is that's going on with them. They might just say, oh, I'm just tired all the time, or I'm just overwhelmed all the time, or, you know, my stomach hurts every day, and, or, you know, I have headaches and that's why I don't want to go to school. And that can be a real challenge to figure out what it is that's causing that, because there could be like organic causes, right? There could be something medical going on. And the thing that's really tricky is that those are also symptoms of things like depression and anxiety. And so it's sort of this like dance of trying to figure out what it is that's going on. But I think even so, you know, if your teen comes to you and says, you know, my head is hurting all the time, I'm waking up every morning with a headache, it's still an opportunity to sort of listen and practice those validation skills, even if it is an organic cause, because you do actually need to understand what's going on before you can solve the problem.
I mean, it really comes down to communication skills, right? And learning coping skills in this really healthy dialogue. And I want to come back to something that I think is super important and helped a lot of people I know. I learned this a long time ago, which is during the pandemic, we learned a lot. There was a lot of opportunity for our kids that were behind a closed door. And when they finally came out, we were so excited they came out. We jumped on them and asked them, are you available for this? Can you do this? We had saved up all of our questions for when that child was available. And it leads me to just remind everybody that when your child has been withdrawing, when they finally come out, to just take that pause, let them have that time for them to come out safely, get their footing, right? Maybe go to the kitchen and get some food, which of course that will get to the eating component of this in a little bit. A second thing I really wanted to bring up is how important it is as parents and as providers for us to take a second and ask ourselves, are my inner children responding to the problem our child is presenting with? Or am I listening to my child and hearing what they're coming up? Because so often, right, it's the subconscious response in us that we're not even aware of from our childhood that we don't want to recreate in our own children. And taking the pause and saying, am I parenting from my own kind of wounded bits, or am I actually parenting from what my child is experiencing in front of me?
Yeah. I think that's so well put. And it's that question of like, where is this coming from? Am I really listening, or am I assuming I understand, right? Because when we assume, that's where a lot of those your own history can kind of come in to fill in the gaps of in information, right? Or the gaps of knowledge. Are you assuming? Are you responding from an emotional place yourself? Which, that's not a bad thing, right? We all have emotions. It shows that you're human. It shows that you care, because you're having an emotional response. And there is this sort of skill in separating out, how do you manage your emotional response so that you can be there for your child. And yeah, it can be really tricky. And I mean, the good thing I will say is that you have a lot of opportunity for practice, because you live with your teen. And so, or at least part of the time you have your teen around. And so it's okay to, to try something and it doesn't work. And then maybe you reflect on it and realize, like, oh, that was totally my own stuff that I was putting up in there. Or like, I didn't realize that actually my teen said this. And I thought, I was assuming that they actually meant something else. But I think this is one of the challenges, right? Because as a parent, I have a lot of friends who have now toddler kids. And so I've seen them go through the newborn stage. And one thing that I've learned is a lot of your job in learning to be a parent is anticipating your kids' needs and figuring out your kids' needs with very little information, right? So from the beginning, your role as a parent, you were socialized to learn, okay, my kid cries and they need something. I need to solve the problem so that my kid will stop crying. And so now you're transitioning to a teenage where, to teenagers where your job actually is not to take away their emotion. It's actually to listen and make space for their emotion so that they learn that their emotions are not something they have to be scared of, so that they can learn to tolerate how they're feeling. And then once they've been able to tolerate it, that's when then the solution comes in, and thinking, okay, do I need to use a coping skill? Do I need to think about how to solve this problem? Do I just need to sit with this? But if we jump to problem solving immediately, really the message that we're giving is your emotion is not valid, or your emotion is not something you should be having.
Or it's somebody else's fault and I'm going to go fix it. I've now taken the entire focus off of you and away.
Yeah.
So let's talk a little bit about, what we're seeing with teenagers and people of all ages, right? In depression. Like we talked a little bit about what are the warning signs, but what if those warning signs got big real fast? The headaches are now chronic. The stomach aches are a constant response to everything, waking up every morning with the stomach ache. How do we do this balancing act between going to see the doctors and making sure that it's not a physical cause, right? We don't have a diagnosable cause. Of course, now we have functional neurology, so there is a diagnosable cause, but how do we get to that place where we really bridge the emotional gap with the physical gap? And as a parent, navigate not putting too much energy on both, but really guiding both concurrently.
Yeah, that's so tricky. And I will say, in my mind, they're not always totally separate. Like, it's not like, oh, there's a physical cause and therefore we don't have to think about the emotional, or there's an emotional cause and therefore we don't have to think about the physical. If you think about something like pain, right? Like chronic pain, for example, actually is really closely connected to a psychological impact. We just call it like emotional distress, right? So it's what we would call like a bidirectional relationship, meaning when you're experiencing pain, that actually turns on your distress signal in your brain. And when you feel over time, when you feel distress, that actually can make your pain worse, because these things in your brain get wired together. And so when one fires, the other one will also turn on. And so I say that it's kind of like I don't know, like complicated way of saying that. To me, these things are not really that cleanly separated. If you think about like any kind of medical condition, I mean, even if you think about something like as simple as a cold, we always have some kind of emotional reaction to having a cold, right? Like we might feel kind of bummed out. We might feel kind of overwhelmed, right? Like maybe you're really happy because you got out of work, but there's usually some kind of reaction that we have. And so these things don't really always exist in isolation. And so I would say it's good to kind of be thinking about both. When you're thinking, okay, well, now we have a teen who's presenting with severe depression, I think it's usually a good idea to get things checked out. And a lot of like primary care settings now do screeners for depression and anxiety. And like I said, if you do have worries about, your kid being significantly depressed, you're not there. There's this sort of myth that I want to kind of debunk that, I've heard this worry that parents have that if you ask your kids about them having suicidal thoughts, that you're going to put that idea in their brain, or that somehow that's going to make them suicidal. So that's been like really clearly debunked. They've done a bunch of studies about this. You can't make your kid become suicidal by asking them. And so if you have that worry, if you're really concerned about your kid's well-being and you're starting to wonder, like, are you starting to feel worried about your kid, and you're kind of thinking like, oh my gosh, are they safe in the house alone? That might actually be a signal that you're having worries about the severity of what's going on with your teen. And it's never a bad idea to ask. I mean, I have worked with parents who like ask every 5 minutes, and that can be kind of like a lot for a teen, but it's never a bad idea to ask about if they're having suicidal thoughts, so that you know what you're dealing with and you can go from there.
You really made me want to talk about what creative healing for youth in pain does right now, because what we see is the brain creating these grooves, right? The pain receptors, whether it's the emotional or the physical, and it's creating these grooves, and it's just repeating this pattern. And then the brain's starting to say, oh, I can only live in this little space, this one lane highway, right? This one lane neurological connective highway in our brain that only knows pain. And so the anxiety sets in that we don't want to do anything outside of that one lane highway, because it's going to be too big. It's going to be too painful. I'm going to have too big of a physiological response, and then I'm going to have an emotional response, and then I'm going to be overwhelmed, and I just can't do it, and I can't go on. And what we see with Dr. Zeltzer's work, and with our kids that, you know, do our camps and meet with doctors like you and meet with our teams of people, is that we can help regroove the brain. Right? We can retrain the brain. We can expand these neuro highways. We can help them feel safe with different activities that we know help expand the brain. And so we can get them to change lanes. It's not just a one lane, anxious, depressed, I can't go on highway. It's a highway that might have cooking. It's a highway that might have talking. It might have, you know, writing. It might have music. It might have movies, but it has something else that we can retrain the brain. And I think you know, what you were talking about made me think about how as parents, we think, oh, my child's depressed, they're going to always be depressed. And what we see with creative healing with youth and pain is that we actually can get that brain to come back online and learn new highways, learn new pathways that aren't all centered around pain. They aren't centered around the emotional pain and the physical pain. We have kids that are bedridden that go to college, that dance, that go to full activities. So I just wanted to reiterate that right there, because I know a lot of parents right now are like, oh, my kid they're just in their room and they're never going to get out of that bed. Right? They're just never going to. And so and that's kind of a great lead into the medicine that we have available to us, what you're seeing that helps. When do we initiate medicine, both from a psychiatric perspective or just something that helps the body say, I'm okay sending a new signal that isn't going to be a pain signal.
Yeah. I think it's such a good point. And I'm really glad that you brought all this up, that, you know, we're talking about what does it mean when when a teen is depressed? Why does that happen? And I think it is really important to convey hope that these things really can change. And I'll say, you know, something I often share out with my teen clients is, from my experience, sometimes actually the teens who go through a really hard time as teenagers and they get appropriate help, you know, they go through therapy, they really practice the skills. Those are actually sometimes the teens who as young adults are kind of have a leg up in life, because they've learned to deal with really difficult things, and they've learned how to cope with it. And we know that as you kind of get older, you know, you think about college age, if your teen goes to college, or if they start transitioning to work, those life transitions can be really disruptive for people. And it's a time of vulnerability where a lot of young adults will start kind of developing different degrees of emotional distress. But if you're a teenager who was able to get a lot of those skills under their belt, that actually might help you prepare for those kind of stages in your life. So I do sometimes like to give that message of hope. Like, you know, those might be times that you want to kind of keep an eye on, but you'll already have those skills. So you might actually get through that time a little more gracefully, maybe, than someone who hadn't had that as experience as a teenager. So I definitely think there's a lot of hope to be had. Yeah,
And it may not be a forever, right, clinical
yeah,
depression where they're never going to get out. And we have so many
totally.
new studies that show how we can really retrain the brain. And
Hmm.
doctors like you that are willing to talk about this, it's not
Hmm.
just, oh, you need to come in the clinic, we need to talk and have medicine. There's just a
Hmm.
whole abundant of opportunities and different things that are available now. So I
Hmm.
always try to remind parents that just because it really looks dire right now, it can
Yeah.
change.
Definitely. Yeah, it definitely can change. I've seen it change for a lot of teens. So I feel pretty optimistic about, I guess, the landscape of treatment for teen depression. You do have a lot of different options for treatment. Some people will go with a combination of medication and therapy. Usually, clinical trials will show that that's one of the more effective combinations. But for teenagers, you do want to make sure that you're talking to a specialist who understands how to manage medication for depression, so antidepressant medication for teens, because there are different unique risks that will come up for teenagers that you just want to make sure that someone kind of has a good handle on. And I'm not a medical doctor. I'm a psychology doctor. So I can talk about, like, for me, the treatment that I provide and other psychologists, like adolescent psychologists, provide are therapies that are pretty structured to work around depression. And those broadly, just to kind of give a sense, is therapies that look at how your thoughts, your behaviors, and your feelings are related, and then kind of help you break out of patterns that got you stuck. So it's exactly what you're talking about with thinking about, your brain kind of creates this one path over time, and it's sort of figuring out what that path is in your life and then breaking out of that path so that you start having different experiences.
Which is the same thing we're talking about with the brain, right?
Exactly.
We're in
Yeah.
this path. How do we get out of it? I mean, I always say
Yeah.
the easiest way is to go left instead of right. Literally, it's as simple as
Mhm.
starting to do
Yeah.
something just slightly different that eventually it's this tiny little dial. It takes these itty bitty microscopic turns until one
Mhm.
day the light is physically on, or
Mhm.
they've moved out of this old patterning that their body wants to repeat, because that's something our body wants to do, right? It learned a pain highway and it
Mhm.
wants to go back. So as parents, we want to help our kids to do anything different so that we're further and further away from that one pain highway, or that one process that
Mhm.
leads to pain.
Yeah. So validation is a really good example of something different, right? If you can get your teen to not be alone in their pain, and to bring you in with them, that's going to feel better than being in it on their own.
Absolutely. I was just thinking about the word perseveration, right? And somatization. And those are concepts
Hmm.
that I think are talked about a little bit more now, but weren't talked about at all before. And I'd love you to talk a little bit about those, because I really do think that's where the body goes, oh, I'm going to stay on this. Dr. Zelter calls it the sticky neural loop, where the smart brain or the brain just overfires and it just gets caught in this loop. And then they perseverate on whatever's going on. But I'd love you to talk about perseveration and on both sides, right? On the physiological response of that, but also, why does the brain do that? And how does a child get stuck in that repetitive thinking?
Yeah. So perseveration, another way to kind of think about it also is in depression, is rumination. It's sort of like your mind just starts having the same thought in a loop. And for depression, it tends to be thoughts around um things like, why me? It's so unfair that this happens to me in my life. Bad things always happen to me. I have no control over my life. Or maybe playing out things in the future that you're anticipating will not go your way. So this is a really kind of common experience in depression, when people have this sort of ruminative thinking, and it can be really challenging to break out of it. One of the things that a lot of sort of more recent therapies are doing is integrating principles around mindfulness to help people be more aware of their thoughts and to find ways to be able to let go of their thoughts, or to place their thoughts kind of down, and noticing when you're kind of picking back up on that cycle of perseveration in your thinking. The thing that can sometimes happen for people, which can be really tricky, is, which I think is what you're alluding to, is that some thoughts are stickier than others. Meaning, and I feel like probably all of us have this, there are some thoughts that you can have, like we all have, intrusive thoughts all the time. You could be walking down the street and then you have like this intrusive image of an earthquake and the ground in front of you like opening up. And depending on your personality and how sticky that thought is, you might be able to just notice it and be like, oh, that's weird, and sort of move on with your day. Or you might get really stuck there. And then, that might get you to really worry. And then you're kind of thinking, you're going online, looking up things about what kind of are the chances that this could happen? What do I do about it? So there are sort of these decision points that we make along the way that sometimes we don't feel like we're in control of. But part of what therapy will do is help you gain a little more control over that process so that you're not following through as much on those thoughts, and you're not giving as much attention on those thoughts. But this is sort of one of the things where depression and anxiety have a little bit of overlap, is in the persistence of your thoughts. So like, there's a really big overlap. So when I think that one of the more recent numbers that I've seen is something between 25 and 50% of teens who are depressed also have meet criteria for anxiety. So these tend to happen together. And one of, like I said, the big areas of overlap is this difficulty around your thoughts and controlling your thoughts. And so there are a lot of different strategies that we use to try to help manage that.
It makes me think right now about the kid that has all these thoughts coming in their head, and they might be really empathetic, right? There's a lot of kids right now that are really feeling things. They pick up on other people's energy and they don't even understand, right? We all come into a room carrying the weight of what just happened, right? Good and bad. And so kids so often are hearing different thoughts that are feelings, and they're hearing thoughts, and then they get really big and they don't know how to decipher what's really theirs and what's not, because there's a lot of people talking in the chat right now about like, what do I do? My kid's isolated, right? But this conversation is really it. It's teaching the brain new ways. And sometimes we talk to our kids. This is the fix that does work when we introduce these new mindfulness techniques, whether they act like they listen to us, whether they hear us, their brain heard us. And their bodies hear us. And I remember learning this a long time ago, right? If you saw the door and behind that door was a traumatic experience, that your eyes are already processing the traumatic experience before your brain is telling you the awareness of that. So you've already released the chemicals, you've already gone into fight or flight, you're already worried about what's on the other side of the door. And his whole approach is start to look at the door and say, I'm safe. Start to use new thoughts around that particular experience that represents fear and anxiety and pain, knowing that our body's already going to be processing it before we're aware of processing it. And how do we then change our thoughts to change our life? So it's another mindfulness technique. That was a really important thought. Change your thoughts. Give yourself permission to say, yeah, I saw that crack. I thought the world might open up. That reminds me of the earthquake I experienced, and I'm really scared. It can also say, I'm safe. I know I'm safe. Let me take a minute to feel I'm safe, and teaching us how to have this self-dialogue.
Yeah.
That's really empowering.
And I will say, one really essential first step that I find probably takes sometimes most of the work is recognizing that you're having a thought, right? And I think that's where parents can come in and sort of like almost like sneakily insert a skill, right? So I think it's usually really hard, even as a therapist, I'll say it can be really challenging to introduce to someone like, hey, maybe we should check the facts around your thought, because that can feel really invalidating depending on the place that you're in emotionally. But one thing that you can do is, if you get your teen talking and you're hearing them, basically they're voicing worries, or they're voicing what you see as thoughts, right? They're saying, bad things always happen to me and everyone hates me and I'm no good. You can actually help them see that, label that as a thought. Wow, it sounds like your brain is really beating you up right now, right? Your brain is being really mean to you right now, or you're having a lot of really hurtful thoughts. And over time, what that will do is help you see that the goal is to help you see that that's a thought. It's not you, right? Because we have thoughts about all kinds of things, right? So I'm here talking to you and my brain is, I'm having a thought about like what I'm going to have for lunch, and like, what I did this morning. And I'm wondering about like, is the angle of my camera right? But I'm choosing to focus on the thoughts around our conversation. But part of that work is being able to identify, these are thoughts, this is not me. These are just kind of noise that my brain is giving me. And that's a really hard thing to do, to be able to identify things as just thoughts. But as a parent, you can actually do a little of that almost like through a scaffolding process, like you're identifying that as a thought for them for now.
Yeah, we just drop in these little bombs, right? Just drop in a little bit here and a little bit there until they start to say, oh, wait, that wasn't my thought.
Right.
Or I'm hearing things, but I'm really not hearing things. It's that are coming through in a louder voice, right? I'm not hearing things. I'm not crazy, but they feel crazy. They feel out of control, right? Their whole bodies are coming online as teenagers.
Mm-hmm.
They're putting all
Yeah.
the pieces together, and it's sometimes just too many pieces at one time.
Yep. Definitely. Yep. So it's, okay, I had that thought. Doesn't mean that it's true, right? Thoughts are not facts. Like I can have a thought right now that I'm an elephant. Doesn't mean I'm an elephant.
And we don't want to make them true. So
Mhm.
let's talk about, for the kids that really are struggling, they're now in their room, they're not coming out, they're
Mhm.
barely letting us in, right? They're throwing things, they're yelling, whatever. We're really having access issues. What would you recommend? Or how do we put in these little bombs, right? How do we come in,
Mhm.
drop a bomb, maybe leave? Or what do we do to help
Mhm.
get them? I mean, and Chip, our whole goal, right, is to get you to now do a webinar from your bed, start to engage, right? We have so much available to us, but how do we get you to come from that fully isolated state? And as a
Mhm.
parent, how do we help?
Yeah. That's so, so tricky when your teen is so stuck that you can't even get them out of their room. A couple things I think about is really paying close attention to what your interactions do look like when you make contact with them. Sometimes people don't notice how much they're asking questions or how much they're kind of like pressuring their kids, which makes a lot of sense, right? If you don't see your kid for 23 hours and then you have 1 hour to see them, you're definitely going to go in wanting to figure out as much as possible what's going on so you can solve the problem. And so kind of going in and really thinking about what we've talked about with the validation, really thinking about not asking a million questions, but kind of being a supportive figure that they can kind of have around. And then I think you're kind of hinting at it that one of the best treatments that we have for depression is something called behavioral activation, and it's really thinking about how do you do the opposite of what your depression is telling you. So depression tells you to stay in bed, it tells you to withdraw, it tells you to basically kind of act like when you have a really bad cold, you have to get into bed, you have to sleep, maybe you're not eating that much because your appetite is gone. And so breaking up those things into the smallest steps possible, where maybe the goal for today is not to get you out of bed, but just to get you to sit up. Right. And so the trick will be, if your teen is not saying that they want that, the trick will be, how can you support your teen in doing a little bit of that without harming your relationship with them? And so sometimes, honestly, the best strategy is it really, I think at that point, is probably trying to find a provider to help you really think about the situation and get you like a structured plan. But you can try small things like maybe you come in and you say, hey, wow, like you really don't want to get out of bed today. Like, I'm just going to join you. How about that? Let's watch a show together.
And they're going to say no. And you just say, you just are already in that bed, and you
Yeah.
make physical contact.
Yeah. Yeah. So maybe you sit on the bed, right? And then the next time you get in the bed, it's a balance, right? It's part of it is trial and error, because you don't want to do something that's going to escalate the situation. So you don't want to do something where your kid's going to like scream at you and then you have to get out of there and then you guys get in a fight and then you leave the room, because that's just going to make it worse. But it's really thinking about, and this is where I think it's hard to give general information because it so depends on the teen. But most teens, when they're hurting, even if they have a really tough exterior, they're really hurting on the inside, and they're really looking for someone to be there for them and to give them some love and support. And so it's the task that I think is a really big task, but really important, is as parents, you really do know your teen best. You spend the most time with them, you've known them for the longest. And so it's thinking about, how can you make your way to that point where they can hear you, and they can see that you're trying to extend them a little bit of caring and you're trying to be there for them. And the goal is to move up over time.
And I'm just thinking of this great saying that one of my teachers taught me a long time ago, and it's say it again for the first time. Don't be afraid to
Mhm.
try it again. And
Yeah.
that time might be the first time that works.
Yeah. I really like that, because what it makes me think about is, how many times as a parent do you find a way to communicate with your teen that you care for them? Families have different norms around this. For some families, it's saying this with words, and for other families, it's saying this with actions. But you've probably done that throughout the course of your life. And sometimes, or throughout the course of your teen's life, sometimes it does take kind of like reintroducing that. Like, I see that you're really hurting, and I want you to know how important you are for me, to me. And I want you to know that I'm here for you.
And don't be
Um,
afraid to repeat it, because that one time might be the time they're able to hear it.
yes,
or
Exactly.
respond, or both.
Mhm. Yep, exactly. So if you see your teen crying, that would be a good time to say that in a really gentle way, and maybe just leaving it at that, right? Sometimes parents will do something where they'll say, I told my kid that I'm here for them and that I love them. And then I just asked them to tell me what was going on. And then I asked them a bunch of questions. Right. And so that's sort of like, that's what I mean by saying, like, really be watchful for that urge to ask questions, because sometimes it's just about making those statements over and over again, or
Right.
like I said, doing those things, because not all families communicate their affection with words. Sometimes the norms are more to communicate with actions. So if it's bringing your teen something, that can go a long way in showing and persisting, showing that you're there, and showing that you're not going anywhere and that you're there to support them.
Yeah. Sometimes it's as simple as bringing them a water, leaving, coming
Mm-hmm.
back 20 minutes later, bringing something else. And I kind of want to introduce the concept of all the different modalities. I know several people have said, what do I do? They're just isolated. There's essential oils, right?
Mm-hmm.
When our child is not going to talk to somebody else, they don't even want to talk to us. What can
Yep.
we introduce? We can introduce things that cross the blood-brain barrier that can create a more positive experience for them. Essential as
Mm-hmm.
you can wear the essential oils on you, drop off a
Mm-hmm.
water, try to give them
Mm-hmm.
a hug, or try to get close, or if they're more available to that, you can provide them with the bottles and leave them by their bed and say, when you're ready, they're here. Or
Mm-hmm.
teach them how to use it for when they are ready. I mean, there's so many things. I know the DBT and CBT, the different modalities were brought up, and I know I'd love to touch on that in the last couple minutes. But I
Mm-hmm.
also want to make sure that I know that those parents are being heard, that there are children out there, there are adults out there,
Mm-hmm.
there are those of us out there that don't want to do anything, don't want to talk to anybody, have
Mm-hmm.
really hit that bottom line, and the only friend we have is our depression. So I
Mm-hmm.
want to talk about those too, but kind of
Yeah.
come back together, go to the CBT, DBT, different
Mm-hmm.
modalities. And then again, I would like to make sure that we close
Yeah.
with those that feel like they cannot make contact and get in.
Yeah. Yeah, the essential oil is such a good example. So DBT is a therapy. It stands for dialectical behavior therapy. It's a pretty intensive therapy. There's an individual component. There's a skills coach, skills training through a group, and sometimes you have a therapist who's available on the phone 24/7, and that therapist has a team that they also talk to. And so it's a therapy that's been shown to be really effective for teens and adults who self-harm, who are chronically suicidal, or what we would call emotionally dysregulated. Um, and so one of I take a lot of skills from DBT, regardless of whether or not the person in front of me sort of meets criteria for full model DBT. And there's this whole package of skills around self-soothing and doing things to help you get through a really difficult period. It's called distress tolerance. And so the essential oils are a really good example of self-soothing. It's doing things that just help you feel okay, like you're soothing your body, right? So like for me, I love to put on creams. So like I'll put on creams, I'm really focusing on the creams. I'm focusing on what it feels like in my skin. And that'll kind of help you just kind of like inject some enjoyment and some kind of just physical soothing into your life when things are looking really dire. And so I think the balance for parents that I often find is knowing how to introduce those skills to your teen, especially if your teen is not asking for them and doesn't feel receptive to help. That's really the big challenge, because sometimes introducing skills can help your teen. And often what I find is that parents will say, like, another skill that we have in DBT is ice. So when you're really, really upset, is putting ice on your face, dunking your face into a bowl of ice water. It can actually really calm your system within a couple of seconds. And you kind of hold your breath in the bowl of water, or you just hold ice. That usually helps people kind of come down on that emotional thermometer. And the thing that I'll often hear from parents is, I'm really confused because sometimes I offer the ice and they take it and it works. And sometimes I offer the ice and they flip out on me and they kick me out of the room. And the challenge there comes back to validation and hearing your teen. And so what I usually recommend, there's no magic solution here, but usually what I recommend that I think works a little better, or has like kind of better odds of success, is just asking for permission, really leading with trying to hear your teen. If there's anything that they're saying, if they're not saying anything with their words, they're usually showing you something, like, okay, they're showing you that they're really hurting, and seeing that, saying, hey, I can see that you're really hurting. I care about you and I'm worried about you. And I want to help, because you're really important to me. You're the most important thing to me. And so Would it be okay if I brought a bowl of ice and we can do this together? Would it be okay if we tried these essential oils? It's not going to take away your problems. It's not going to solve everything that's going on in your life, but it might basically bring you from up here to down here, and maybe even to down here, so that we can think about what's going on and help you solve maybe not all of your problems, but maybe help you solve the problem of not being able to get out of bed today.
I appreciate that. And, with the last 3 minutes, and I really want to touch on one of the most important questions, which is when do we take our children to the ER? When is it serious enough? And we've got all these different things we can do to try to prevent this. But there is a time that we need to make sure that we're getting outside help. And right before we get to that, I want to remind parents that one of the most useful tools is to actually sign up for parenting help that you have weekly with a therapist. If your child won't do it. And so I would like to come back to when is it that these tools and all these things just aren't reaching our children? When do we go to the ER?
Yeah, I love that. First, for sure, parenting group. I'll say my general goal is to try to get help before you need to go to the ER. So if you're worried about your kid, if you tell me your teen is in bed all day and won't get out of bed and that's lasted for weeks, I would say really important that you try to get a therapist, and maybe it's a therapist online, whatever it takes to get them connected with someone. But the ER question, if you're worried about your kid's safety in the immediate term, if you're hearing your kids saying, I'm going to kill myself, if you hear them saying, even if they just sort of kind of voice it, like, I thought about a way that I could do it, definitely if they tell you they have a plan, and definitely if they have recently done something, like an overdose, taken more pills than necessary and told you that they were trying to die, or done anything dangerous. Basically, if you're worried that you're not going to be able to keep your kids safe, that's a time to go to the ER. And most importantly, it's a time to make sure that you get connected with someone. Because, sometimes a really common thing that we see is that kids will have a suicide attempt. They'll go to the ER. And then actually 50% of kids who go to the ER after a suicide attempt never get any follow-up care. So, a kid is attempted, they go to the hospital, and then there's no follow-up. And a lot of times what happens there is the kid says, this is a one-time thing. I feel better. I don't need to see anyone. And, it's such a traumatic experience for the family that, of course, everyone wishes that were true. And in most of the cases, that may be true for the short term, but in most of the cases, that's not true. In most of the cases, there is really a need for follow-up care. And so I would say that's definitely a time to prioritize pushing some provider. Even if your kid says that they don't want to go, as parents, you usually have a lot of leverage to get your kids to go and do things that they don't want to do. Maybe can you make a deal that they'll try it for 4 sessions? And if they hate it after 4 sessions, then you can revisit and let that provider know, so that they can really work on building a relationship with your teen and getting them engaged and getting them to talk about the things that are going on in their life that basically get them away from the life they want, because the goal is to get them the life that they want.
Well, thank you so much, Dr. Vargas, for spending this time and just so openly talking about such a hard subject and trying to bring some light into some opportunities to not let things get so far down the road. And I know we could talk another hour easily. I know we're just getting started. There's so many resources out there. There's so many wonderful doctors out there. There's so many things. So don't be afraid to reach out way before things get so dire. And Chip is in Creative Healing for Youth in Pain is definitely a partner with great doctors like Dr. Vargas all the time on this. So we're all here for you. Thank you again for joining us. And I look forward to another opportunity to speak with you, because I think we were just getting started, I'm afraid.
Definitely. Yeah. Thank you so much for having me, and really such a pleasure. And thank you to the parents for your questions. Yeah, we're always thinking of you, and please do reach out. There are a lot of resources online.
Thank you, everybody. Thank you for the CHIP team, and we'll see you next month.